Welcome to Neogenesis Nutrition, your place for a new beginning, where health is not just a destination, but a profound and transformative odyssey. Hello, I'm Dr. Jennifer Champion, Doctor of Clinical Nutrition, board-certified hypnotherapist, author, and a general badass. With a relentless dedication to challenging the status quo and pushing the boundaries of conventional medical wisdom, I have earned a reputation as a fearless pioneer in the functional nutrition world. Developed out of grief and armed with a deep-rooted passion for uncovering the underlying causes of disease and dysfunction, I embarked on a journey of discovery that led me far beyond the confines of traditional medical and nutrition education. I refused to accept the limitations of mainstream approaches and instead delved into the realms of alternative therapies, functional medicine, and cutting-edge nutritional science. All right, well, welcome back, listeners. Today, I'm very excited to have Dr. Kelsey Clevenger. She is the mobile chiro here in the greater Tacoma area, for those of you who are outside of Washington. For those of you who are inside of Washington, she tends to be in the whole Thurston County area. So if you're looking for a chiro and you don't have space, she's going to be a really good match for you. And we'll get to have her share her details on how you can get a hold of her later at the end of our show. But today we're going to be focusing in on chiropractic and the central nervous system and how to regulate it. In fact, she just completed her very first summit on this topic, especially the central nervous system for women and healing. So I'm hoping that she'll share some of her experiences as we go through. But for right now, I'm going to allow her to introduce herself. So Dr. Kelsey, would you take it away? And if you want me to call you Dr. Clevenger, let me know.
Oh, Dr. Kelsey is great. Thank you.
Okay. Mm-hmm.
I am so happy to be here. Thank you, first of all.
Of course.
So a little bit about me. I am first and foremost a mama to a toddler, which is my favorite role. But the purpose and calling of my life has been to serve women in this nervous system regulating space. And for me, that has grown into chiropractic, nutrition on a micronutrient level, and then nervous system regulating tools and techniques such as meditation, breathwork, EFT, etc., with a focus on helping my patients grow in confidence and autonomy to be able to support their own healing process while I guide and support them.
Excellent. So tell me, how did you get into, I mean, obviously your doctorate is in chiropractic. Tell me how that story started for you, because when I talk to most chiropractors, they didn't like shoot out the womb and go, I'm a chiropractor. Like they kind of stumbled into it. So was that true for you, or did you kind of always know that this is something that you wanted to do?
Oh, that's a good question. And no, I didn't know. I came out of the womb knowing I wanted to be a doctor. Like I did know that. And I
Okay.
always knew, I remembered when I was 17, I was like, okay, I'm going to get a doctorate. I'm going to buy my house. I'm going to do this. And by 31, it was like the age 31, if I don't have a husband, I'm going to adopt and I'm going to have this practice. I'm going to be a medical doctor, all the things.
Mm-hmm.
So I grew up thinking traditional medicine, MD, was going to be more of my route. But I was a super sick kid. I didn't know at the time, we didn't know at the time, a lot of that was nervous system dysregulation from past traumas. I experienced a lot of hard things as a little one that I didn't have a space to process. And it manifested for me as chronic GI issues, severe inflammation. When I look at pictures of myself as a child, I was technically obese. But when I look at pictures now that I know what inflammation looks like versus adipose tissue, for me, it was so clear. It was inflammation, but I had chronic sinus infections. And so I was on antibiotics all the time. I just was a really, really sick kid. Then I had mental health issues. I had psychocytic seizures, a thyroid condition. Like it just kept manifesting and manifesting into like bigger medical conditions. And I did not feel well supported by the medical system, which I know is a lot of people's story, especially when they get into more alternative healing modalities. Is, I had like diarrhea every day for over a year, and I was told, well, you have IBS. And that was it. That was the end of the story. And
Mm.
so I am grateful that I started rubbing elbows with people who had a little bit more of a natural approach to life and to healing and health and nutrition. And I learned about essential oils and clean eating and then paleo diet and just different
Mhm.
things where I was removing toxins from my environment. I was removing toxins from my diet. And I started having an awakening of maybe a holistic way of healing could serve me. And at that time, I still didn't know the nervous system aspect of it.
Sure.
I knew more of like the chemical aspect. I mean, exercise was already a part of my routine. I really dove into therapy and started working on some of the things. And then I was a personal trainer at the time, and I just was growing bored. I didn't want to help people exercise and lose weight and yo-yo diet. I was super
Mhm.
bored. And I'd always knew again that I was going to be a doctor, but what happened is over time I didn't think I was smart enough.
Right.
I had such a low self-esteem and low self-worth that I did not pursue medicine because I didn't think I was smart. And I remember this particular client, personal training client, she was having this severe pain in the back of her knee. And her ortho was giving her injections in the knee. They just couldn't figure out what was going on. And I told her, I think it's coming from your back. And part of that was intuitive. Part of that was because I actually had a spinal fusion when I was 15. And so I knew a little bit about spinal health from my own
Hmm.
experience. And it turned out that it was coming from her back. It was spinal stenosis. And as soon as that was corrected, the knee pain was gone. And for me, that was this moment of like, I think I need to go and be a chiropractor because that felt really easy for me. And
Hmm.
so I secretly applied to chiropractic college. I didn't tell anyone because, again, I thought I was dumb. So I was like, I don't want to tell anyone and then be embarrassed if I don't get in.
Oh,
I know. It's like in hindsight, I'm like, oh, that sweet little version of me.
right. I'm just like over here, my heart
I
breaking.
know. I know, but that was all part of the journey and all part of like that
Yeah.
story of, growing into this space. And I like to share it because even at that time, people thought I had it all together because I was really good at faking it. I was really good at perfectionism. I was really, really good at making this like nice looking package on the outside who
Mhm.
was not okay on the inside. So I applied to chiropractic college and I actually got a recruitment scholarship to come sooner
Wow.
because I wasn't dumb. Who would have thought?
Well, I can tell, but I know you today.
But that was one of those moments where I was like, oh, like I can do this. And that is how I got into chiropractic. And simultaneously, one of my girlfriends actually was getting neuro-emotional technique with the chiropractor local to her. I had never even experienced it, but what she told me about it, instantly I was like, I want to do this. I want to do nervous system healing. I want to help people process emotions and work on their back because that felt like something tangible that I could do. And that's how it all manifested and happened.
I think that's amazing. I mean, I'm a little shocked, because I've only known you briefly, and we've had a few encounters, but my experience of you is anything other than, oh my gosh, this chick is dumb as a box of rocks. Um, because me being autistic and Jewish, I would just tell you, like, dude, open a book, try it. There's words, read each one, string them together for a thought. Um, but like that's not how I see you at all. So to hear you say that is pretty amazing. And in one of my previous podcasts, we talked about the imposter syndrome and
Mm,
how significant that is, especially for women. It happens to men too, absolutely. Uh,
mhm,
that I just find that my male population, they can mask or hide it or whatever behind this masculinity, this masculine
Mm-hmm.
energy,
Mm-hmm.
and we just go, oh, okay, yeah. But us women, we come off as a little bit more timid, and
Mm-hmm.
when we feel like we don't know, we find ourselves saying, "I'm sorry" a lot. And that's one of the things that I work on with my clients. Like, if you say, "I'm sorry" in my session, I'm going to charge you an extra dollar every time you do it. And I said, I'm going to get rich off of you, or you're going to stop it real quick. So,
Love
uh,
that.
well, because we just do that, right? We apologize for
Yeah,
everything when in reality we're apologizing for our existence.
right.
And we don't need to. So I'd love to hear a little bit more about this neuro-emotional technique that you were privy to, or it sounded like you experienced it yourself. Can you share a little bit about that? Because I'm not familiar with that at all.
Yeah, neuro-emotional technique was developed by Dr. Walker in California. He's a chiropractor. He and his wife headed up, and they do seminars all over the world and teaching. Really, now it's progressed to anybody with a essentially master's and higher. And I've been to seminars with dentists and anesthesiologists who are learning it, mental health counselors. It really is growing in regard to the different practitioners who are utilizing it. But neuro-emotional technique is founded on the basis of using the acupressure meridian entry points on the wrist, which are associated with every emotion, which are also associated and correlated to the different visceral systems and to all the spinal levels.
Mm-hmm.
And so for me being like a hands-on practitioner, I can go in, we call it like go in when we built like that congruency and rapport with the patient and kind of guide them and help them through, I would say similar to a hypnosis, and guiding them to either the first time they felt that emotion. Sometimes it regresses past lives, sometimes, and a lot of times it's in utero. And then we help them process it through a breathing technique. And they're able to, I mean, it's essentially like if you have a thorn in your thumb and it's festering, what NET does is it pulls the thorn out. And then we trust that your immune system then is going to come and heal that spot.
Oh, okay. Interesting. And is that similar or very different to the EFT, the emotional freedom technique that you were doing at the summit? Is it the same?
Different. So
Different. Okay.
neuro emotional technique is practitioner guided, where EFT, I mean, EFT obviously can be practitioner guided as well. The way I teach it for my patients is to teach them to do it on their own. So my philosophy is EFT is for my patients in between the NET sessions. Um, and I've expanded my neuro emotional technique practice to also adding like deletion of holographs and some hypnosis. It's definitely expanded beyond just a very straight neuro emotional technique, as I've experienced different things. But yeah, thank you. That's a good question. The EFT, for me, EFT in my practice is this is your homework. You're going to do this before I see you again.
Gotcha. Okay. And do you find that this connects in with the chiropractic? Are you doing them the neuro-emotional and the chiropractic at the same time? Can you build all that into one, or is it too much for the nervous system all at once?
So generally, if a patient is willing and wants to also do the neuroemotional technique, I stimulate the nerve roots that are associated with the emotions that they're clearing, but that is the entire adjustment that they would have for that day.
Okay.
So I like to focus in on exactly what we're working on versus, like, for example, I don't want to overstimulate the sympathetic nervous system by releasing their entire thoracic spine when all of the emotions that they're clearing, say, are coming from more like that L5S1 sacral area. I would kind of be undoing what we just did from a nervous system stance.
Oh, okay. I mean, this is just fascinating to me. Of course, my sponge-like brain is like, suck it all in, suck it all in. And like for me, one of my trauma responses, and I've shared this with the listeners before, is just I'm a hyper rational, hyper achiever. And
Mm-hmm.
so for me, like if I'm stressed or if I'm anxious or something, right? Something has triggered me in some way, shape, or form. I'm looking into, let's go get another certificate. let's go justify my self-worth by getting more letters. There's got to be
Yeah.
something with an X and a Y in it, type of thing. So I'm listening to what you're saying, Dr. Kelsey, but I'm also going, okay, Jen, you don't need to take this on. This is her field.
I feel
So,
that though. I feel that because like often I'll come across something, the algorithms on social media, even though I don't scroll very much, it always is a new technique that I'm like, oh, I should go to that seminar in Spain. I should do that.
should. You
And it's
should
just like,
just to go to Spain.
well, but I mean, it's like every little thing I'm like, I need to do that one
Yeah,
too. And I need to do that one too. And it's like, hello, like
right.
focus on what you're, really passionate about. But I'm like you in that where I'm like, oh, let me go get formally trained in that. I mean, I even have a plan to go get another doctorate. So,
Oh, in what?
well, maybe naturopathy, but also I've been thinking about becoming a midwife. But
Oh,
again, it's
fun.
one of those responses where I was very stressed, where I had a big life change, and I was just
Mm-hmm.
like, oh, while I start this brand new chiropractic business, why don't I go be a midwife too? Because now I finally have the time to go to midwifery school. When before, when I was an associate working for someone else, I couldn't have gone to midwifery school. Okay, hold up. Like, just stop.
Right. Oh my gosh. I think we have a lot of parallelism. And maybe that's why when I was speaking at the summit, I looked over, because I pan the audience, but I happened to look over at you right at the time that I said, like I was working 3 or 4 jobs, working on a coaching certification, as well as being a single mom, and throw my doctorate in there. And I think I got to you, and I thought I saw like a little, almost a giggle that occurred
Oh yeah.
over in your corner. I was like, oh, she thinks I'm nuts. Like, and I'm
Oh
like,
no,
she's
no,
not
I
wrong.
literally, my thought was, oh my gosh, that's why we connected. We are the same.
I'm just you in the future with gray hair. That's all. Gosh, so when you're working with someone and I think any of us that are in this quote unquote alternative health space, and I
Mhm.
use the quotes because we are the OGs of healthcare.
Yes,
We are the fundamentalists of healthcare.
yes.
Make sure your spine is aligned and you're eating the right foods and you're sleeping and you're having good bowel movements and you have time for play, whatever that play looks like for you. We're the ones that have been doing that, and it's more the mainstream medical that came in and took over and said, no, it's got to be this way, pills or,
Hmm.
that's it. Um, so I know that every one of us that goes into this has a certain capacity, and I really feel like those of us with trauma have a greater capacity to sense or feel, oh, this client's off. Yeah, this is not just a structural integrity thing for me right now, but
Hmm.
this is also stored, you got low back pain and you don't feel supported, or you've got a urinary tract infection, you're angry about something. Like, what is going on? So, how do you notice, or what are your feelings or sensations, for lack of better terminology, when you're working with somebody and you can sense this goes beyond just rack and crack, which is what most people consider chiropractors. I don't. I love
Hmm.
you all. And in fact, when I was going through my doctorate, I said, I'm going to partner with as many chiropractors as possible. And the dean was like, don't do that. And I was at an alternative school and I was like, no, no, like I can do everything else, you know, but I cannot adjust. I can't put hands on people.
Hmm.
So, what are the things that you pick up on from people that you kind of leads you down that conversational pathway?
Yeah. Well, there are a few things. One of which is a gifting that I learned about when I was in chiropractic college. So I've always been a kinesthetic learner, and I would get my hands on people as much as possible, while, especially when I was in school, because the book side of it was really hard for me. But touching people and doing that side, it was like I was finally in my like zone. And what I learned through that is I can feel inflammation and it feels warm to me in a way that is
Hmm.
not textbook, right? So
Yeah.
I can feel heat radiating off my patient without even touching them. My hand can be 6 feet, 6 inches away, and I can feel the inflammation and the heat that's associated with the emotion that they are repressed and holding in that space.
Hmm.
So when I first learned that, one, I was the weirdo because even within the chiropractic college realm, like that is super weird and that is not normal. And I was the weirdo, but I embraced it because I was like, I feel this. Like there is something going on that I am feeling. And I didn't know how to put a name to it. I didn't really understand it, but that was just my truth and my experience. And because I was weird, I thought, like, you know what? This is different. And I'm going to really hone in on this. I'm going to learn how to use this because this isn't something my peers are doing. And I mean, even chiropractors disagree on how we should adjust and how many segments
Hmm.
should we adjust and how, like, should we just do the upper cervical or should we adjust everything? Like, even within my own profession, there are all these disagreements. And I don't think that one way is the correct way, but I think that the way that speaks to that practitioner is going to speak to their patients. And so for me, I've I would say attracted patients who are maybe a little leery of the muscle testing and me letting them know that, hey, you're suppressing an emotion here. Let's muscle test it and confirm. Maybe they're a little leery at the beginning, but for the most part, they're very open to that. I've just attracted patients who they're like, you know what? I've tried all these other things. Like, this sounds weird, but let's do it. So
Yeah.
that has been one way that has come about. Um, can we go back to the rest of the question? Because I'm almost like like going down a rabbit trail that feels a little bit off. Can you bring me back in, please, Dr. Champion?
Sure, sure. No, and you're welcome to take the question in any direction you want, but it was more along the lines of how you sense, and I feel like you did answer that by saying like it's an intuitive, it's a I'm drawn to that kind of space. I can
Mhm.
feel the inflammation radiating off that person 6 inches above their body. And that's again, I think that that's a gift because if you want to bring religion or spirituality in, we have the concept of laying on of hands. And I really do feel like that there are some of us that are gifted with that. I know
Mhm.
when I'm doing Reiki on any of my clients that come into the office space, I don't do distance just because I want to be in that person's presence. I will get messages or I will get visions. And a
Mhm.
lot of times they appear as color, which I think is very fascinating because I'm also artistic. And so I think a lot in images, I think a lot in pictures. So it sounds like you have your own gift, your own way of doing things. And I'm so glad that you didn't let your professors beat it out of you. And this is the only way you can do this. And you have to do it by the
Mhm.
textbook because the people that are drawn to you are the ones that need to be in your space, right?
Mhm.
So no,
Yeah.
I think you did answer the question, rabbit ears and all. So I think it was good. I
Well,
think it was
even when we were recapping, I was
Mhm.
remembering the other point that I wanted to share because human design has transformed the way that I see myself. Um, are you familiar with human design?
Mhm. Yeah.
Okay, so I'm a projector.
Mm.
And that was part of, as soon as you said intuition, I was like, this was the part I wanted to share. Is
Mhm.
because as soon as I learned that I was a projector, one, and then two, that I have splenic authority, meaning I need to go off of my intuition, I really tapped into that of, okay, I'm going to listen to that gut instinct. Obviously, knowing the science and knowing the other parts of my profession, the evidence-based aspects of it,
Sure.
but listening to my intuition in such an intimate way. And it's actually led me to helping patients figure out root causes to whatever was going on based on leaning into that splenic authority.
So I'm familiar with human design, but I'm not sure that all the listeners are.
Yeah.
Can you do a little brief synopsis of what that is so that people can understand?
Yeah. And I will preface, I'm not an expert. I'm definitely one who's learning.
It's all
But
good.
human design is based off of the astrology of what was going on at the location and the time of your birth. So you can look up your own human design with your date of birth, time of birth, location of birth. My human design is a great resource. And there are five different types And then a person can learn their type, for example, projector, and then kind of deep dive and figure out like what ways you digest food better. How do you make decisions? Um, like, for example, are you intuitive or not? One of the main things that's really helped me and parenting with my daughter is the emotional versus non-emotional side of it. So there's just so much that, and with me not being an expert and being a student, um, it really has been transformative. I utilize it with my coaching clients, and every single person has said, this is basically de-shamed me. So things that people told
Mm.
me about myself that I thought were bad, human design teaches me why it's good and why it's a superpower. And that's a big reason why I lean into it so much.
Oh yeah, anywhere we can take that feeling of there's something wrong, something fundamentally wrong with me, off of our clients, our friends, our family members, and
Mhm.
especially ourselves, right, as providers, because we're constantly filling up everybody else's cup and then wondering like, who's filling mine, and this is a way that we can fill up our own cup as well by recognizing that there isn't anything shameful or fundamentally
Mhm.
wrong with us. So awesome.
Mhm.
Thank you. Um, and now, do you have any favorite patient client stories that you would feel comfortable sharing where you were able to help that individual kind of reintegrate into their body and that also helped with their structural integrity? Is that a okay leap to make?
Yeah, that's definitely an okay leap to make. And if we, kind of get to the foundation of it, there's this disagreement and conversation of like, is it the tight muscle that's causing the spine to get out of alignment? Or is it a nervous system response that then is affecting the structure? Um, Chiropractors in general, we're moving away from the spine is out of alignment. Let me air quote that,
Mhm.
and moving more into there's a nervous system response that's causing an inhibition or a decrease of range of motion in the joint. I want to restore motion into that joint. I want to improve the blood flow there, the immune response, and I want to make sure that the lymph is flowing. I want to make sure cerebrospinal fluid is flowing. So, kind of taking a different from that rack and crack and more of like how are all of the systems and the fluids which are so important, how are they all coming together and how is this synergistically working? And one of the things and because well, I guess I will say I interned in an office that does CBP, which is a structural correction. So it's chiropractic biophysics. It's amazing. It's very, very structured of like the patients have a very demanding care plan and these particular exercises. There's vibration, there's all kinds of cool modalities. And the idea is to put curve back into the spine. And even in that scenario, I saw such amazing things happening. Um, but with me having my passion more in the nervous system regulating emotional side of it, what I've seen is especially when so I had this patient a few years ago. She was very meek in her posture, like head forward, um, chest slumped forward, shoulders forward, very quiet, very fawning when it comes to nervous system response. And we were able to slowly start integrating the emotional clearing, and what I noticed over that next year is she stood taller. Her shoulders were back. I don't have x-rays to compare, so I can't say, oh, her spinal curve changed. I can't say that, but I can say that she went from a very closed, anterior forward slumped posture to being able to, um, she had better range of motion in her spine, but she also had a more confident posture. And is that merely the confidence that she gained from clearing the traumas, loving herself more? Maybe. But also, I noticed the difference in the tone of her tissues. She had like chronic spasms and trigger points. And after we cleared all of that and she had better range of motion in her spine, the spasms and the trigger points were gone. So it's kind of like the chicken and the egg, but anecdotally, I see that as we improve posture, as we improve nervous system regulation, the entire being starts to radiate and they just change structurally.
Mm. That's awesome. I love hear I love hearing how, we can bring in all the different modalities that a client or a patient in your case needs,
Mhm.
and doing it in a safe space. And you mentioned early on in the session that you also bring in like micronutrients and mindfulness or breath work and things like that.
Yeah.
How much of that comes into play with your patient population?
Yeah. So every single patient of mine learns breath work. They learn how to breathe diaphragmatically appropriately. So most of us are chest breathing. So I
Mhm.
start with just the structure of it and explain to them how diaphragmatic breathing is going to better support not only their nervous system, but their pelvic floor, their spinal alignment, the alignment of their ribs. I go very like structure in the very beginning because that's what makes sense for most patients when you have a chiropractor, you think they're going to work structure. So we start with the
Mhm.
diaphragmatic breathing, one, because that's the foundation, in my opinion, to breathe appropriately before I do breath work with you. But also it's a rapport builder, because
Mhm.
it makes sense. And then from there, I utilize a lot of vibration with active range of motion. So a patient may be um, doing bringing their head all the way back and then tucking their chin down, and I'm doing vibration on their spine. But I've also cued them of like when to inhale, when to exhale, and we practice the breath work holding their breath and different aspects of it while they're getting their treatment. And the idea
Mhm.
is it's regulating their nervous system. And while we utilize the vibration, which blocks pain reception or nociception, they actually have improved range of motion and decreased pain before I even do the adjustment.
Do you find that the breath work that you're doing helps your clients to relax? I know when I get adjusted, especially the neck, I immediately tense up. And I know I'm not alone there, but I immediately tense up like, oh my gosh, I'm never going to be able to walk again. Like that's the first thing that pops into my brain. And while I know that that is extremely rare, my brain just doesn't, again, and then there's the whole you're touching me. Why are you touching me concept.
Yeah.
So do I know you well enough? So do you find that when you start with that breath work, it also helps your patient that's, on the table relax and you can get a better adjustment for them?
Absolutely. Well, and especially for the patients that I know either have not paused during the day once to check in with themselves and they're just on like that go 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 like that
Mhm.
very fight or flight. They may not even cognitively be thinking like, oh my gosh, are they going to kill me with this adjustment? They may not even be thinking that, but they've just been on the go all day, so they're very high strung. They will get a very intentional breath work moment before the adjustment to relax. But then yes, the people who are nervous about the adjustment, or have had a bad experience in the past. Because unfortunately, I have a lot of patients who've had bad chiropractic experiences. If we do either a heart brain coherence exercise where we're just connecting heart and brain to feel more peaceful and grounded, or we do some specific breath work, it does help them relax and it helps the adjustment go so smooth.
Yeah, that was kind of what I was thinking is maybe I need to start doing some of that, you know, before I go in. So the chiropractor that I go to, I have to drive, a good 30, 40 minutes to get up there, but it's riddled with dad jokes and not great ones. So I think he uses that technique, but a little
Mhm.
different, but I don't know that it's necessarily the best match for me. So now my curiosity is definitely piqued. Now, if somebody wanted to work with you, Dr. Kelsey, how would they get in contact with you,
The
especially for
best,
those in this area?
yeah, the best way would be through my website. Should I share that? Are we
Yeah,
linking? Okay.
yeah, we'll do both.
Okay. It's dr-kelsey.com/the mobile chiro. You can find me on all the social medias as well, the mobile chiro. Um, but yeah, it would start with a conversation to see if it's a good fit. Because also I do concierge work only. So I go
Mhm.
into my patients' homes or places of employment. I make chiropractic very accessible and easy. But we have to make sure that it's a good fit before you invite me into your home and I come to your home and all the things.
Yeah, absolutely. And is there a phone number that you want to give the audience,
Oh yeah,
or just
of
go right to
course.
the website?
Yeah, my you can text or call 360-359-2980 and I will be answering. I am a solo practitioner, so I am my front desk lady too.
Well, good, good. So you get to be the boss and the employee all at the
Yeah,
same time.
I'm HR, I do the write-ups, I do all of it.
I love it. Write yourself up. Whenever I hire somebody, I always let them know, don't have an HR zone. So if you're sensitive, you're probably not going to want to work here. And fortunately, I've gotten some really good staff, and we can banter back and forth and not have to worry about that. So, um, absolutely. Thank you so much for joining us today. I know that the listeners are going to geek out on this just because it's something new, it's something different than what a lot of them have probably experienced in the past. So I really appreciate it. Is there anything that you'd like to leave the listeners with today?
The biggest thing, honestly, I would leave with the listeners as a tangible tool is yes, call me, text me, let's work together, but learn your human design. Because, and this is one thing like I said, I have my clients and patients learn too, because as soon as we unshame and rewire the negative things that we think about ourselves, we get to thrive and we get to expand and we get to grow. And healing your nervous system starts with that, is identifying and learning and knowing like maybe you're not a piece of crap. Maybe you're an amazing, remarkable human and you need to learn that. And that's going to propel your healing journey. So that would be a
Yeah.
tangible, free way to start healing today.
Yeah, absolutely. Well, and I think that anything that we can do to start that conversation with ourselves, maybe it's you've been a bit intimidated to go and sit in a therapeutic environment, or maybe you don't have access to, individuals like Dr. Kelsey, but you have the ability to log onto a website,
Hmm.
and most everybody has the internet, and if you don't, you can go to the library and start that healing process by finding out what your human design is and to start releasing some of that shame around you and the narrative that was given to you while you were growing up,
Yeah.
because everybody is here for a purpose. So, all right, Dr. Kelsey, well, thank you again so much for joining us today. I really do appreciate it. And as always, listeners, keep in mind that you can never heal a body that you don't love. So learn to love the body that you're in. Until next time, take care. Are you ready to embark on a journey towards a healthier, happier you? Welcome to the Neogenesis Nutrition Podcast, your ultimate guide to holistic wellness and transformative health. Our podcast isn't just another health show. It's your gateway to discovering the power of nutrition, the joy of balanced living, and the freedom of a body positive mindset. Each episode is packed with expert interviews, practical tips, and inspiring stories that empower you to take charge of your well-being. Whether you're looking to boost your energy, overcome an eating disorder, or simply feel better in your own skin, we've got you covered. Ready to take the next step? Call us today at 253-507-5775 to schedule your initial consultation. Let's create a personalized plan that fits your unique needs and helps you achieve your health goals. Don't wait. Your transformation begins now. Call 253-507-5775 or visit us on the World Wide Web at neogenesisnutrition.com to schedule your appointment. Neogenesis Nutrition Podcast, where your journey to to a healthier life begins. Subscribe now and let's nourish your body and soul together.